All right. Well, today we have the great honor to welcome with us Reverend Jessica Chapman. She is an ordained minister in the United Church of Christ here in Southern California. Currently, she is serving part-time at Kaiser Permanente, Orange County as a clinical chaplain. She's also full-time completing her PhD in spiritual care and counseling at the Claremont School of Theology. And so she has had a long history with chaplaincy work here in the area. And we know that right now during COVID-19, there are unique challenges of providing care to people who are in the hospital. We probably have had personal experiences with loved ones, and that sort of distance makes it really hard to grieve or to show compassion and love to those who we know are in need of our care. So we thought it would be really fruitful to hear from someone who's working in chaplaincy what that sort of looks like for families and what the work of chaplaincy is in this era of COVID-19. So if we could please all join together and welcoming Reverend Chapman, the floor is yours.
Thank you. Thank you, Pastor Jacob. I appreciate the invitation to be with you all today. This is my second time being a part of Sunday school, and I really appreciate being a part of this exploration with you all. So as Pastor Jacob mentioned, I am a clinical chaplain. In the beginning of the pandemic, I was also a hospice chaplain while serving part-time as a hospital chaplain. And so I would love to offer some reflections from both my time as a hospice chaplain and as a hospital chaplain during the pandemic. And then invite conversation around any questions that you all may have about clinical chaplaincy in particular, and just maybe invite conversation about anything that was stirred up in this moment for you guys, maybe from my reflections. So first, I would like to center ourselves. This is a centering exercise that I provided continuously for some of the nurses and the CNAs and the physicians that I worked with, especially in the beginning of the pandemic. What I found was that a lot of the clinicians wanted meditations to help center themselves as they met day. And so I would invite you to join me in the same meditation that I offered them. This is a 3-part breathing meditation where I will invite you to breathe in deeply through your nose for 4 seconds, to hold it for 5 seconds, and then to exhale for 6 seconds. So I invite you to be in a comfortable seated position. Close your eyes if you feel led. And I invite you to breathe in deeply through your nose for 4, 3, 2, and 1. And hold for 5, 4, 3, 2, 1. And exhale through your mouth for 6, 5, 4, 3, 2, and 1. Again, breathe in deeply through your nose for 4, 3, 2, 1, and hold for 5, 4, 3, 2, 1, and exhale for 6, 5, 4, 3, 2, and 1. And I encourage you to keep that breath pattern throughout our meditation. So now as we breathe in peace, peace that allows us to serve others with fullness and grace. And we hold that peace in our spirits. And we then breathe out our anxieties and worries that don't serve us as we do our work in the world. We breathe in hope, hope that this too shall pass. And we breathe out any doubt and fear of what is to come. We breathe in acceptance of what was, what is, and what will come. And we hold that acceptance in our bodies. And we then breathe out fear of the unknown, fear of uncertainty, fear of chaos, and fear of grief. We breathe in love. We breathe in love for ourselves, our families, our patients, our communities. And we hold that love for the world that is broken, yet healing. And we breathe out all that limits our ability to give love, receive love, and embrace love during a time such as this. Amen. So thank you for joining me in that meditation. It's difficult for me to acknowledge the challenges that I have had as a clinical chaplain throughout this pandemic without first acknowledging the heroism of the nurses and CNAs and housekeeping and respiratory therapists and physicians. And for me, a large majority of my role as a chaplain throughout this time has been to care for those people. So I want to start by sharing a brief example of their magical and healing work. So at one of our hospitals in Orange County, we had an older couple who were both dying from COVID-19. And the palliative care team, whom the chaplains work with, were called in to offer support as the family, as the patients transitioned to comfort care. And what the palliative care team achieved in that was they basically merged two ICU rooms together and allowed the couple to pass away hand in hand. I want to make it clear that the palliative care team mostly did this remotely. And so that's another kind of additional layer to clinical work across all disciplines right now in this pandemic, the idea of telehealth. And so because many hospital systems, chaplaincy is not something that needs to happen face-to-face, almost overnight, chaplains went from in-person to providing care on a telehealth platform. And so what that meant for me and for my colleagues was that we had to learn different technology platforms that were learning curves for even myself as a millennial in order to provide care in both the inpatient and outpatient settings. So if a patient was passing away, chaplains were often asked to provide prayer through a video conference, and priests were also asked to provide sacrament of the sick through video as well. So just to give you some background of kind of how chaplaincy and clinical care in general and spiritual care is being provided currently in the hospice and hospital settings. Now, a lot of times chaplains and social workers as well are starting to make visits to families and patients, but a lot of our work continues to be through telehealth, which is something that is definitely a challenge to learn. So I would also like to share just some reflections. So I want to share about an on-call evening for myself. As the chaplain, I'm on call often overnight. And then I was asked to check in with the family of a patient who just recently passed away from COVID. The family was understandably upset, and they directed their anger towards the entire situation towards me at the time. And in this particular woman's anger, what I heard from her was grief, was a loss of control. And I think most importantly, the family member felt that the patient, because they had COVID, they died alone. And they felt that the nurses didn't want to go into the room, and they knew that not many other people were allowed to go into the room. And so she really thought that it was because of her loved one's diagnosis of COVID-19 that the loved one passed away. And the family member was absolutely distraught that her loved one passed away with no one holding her hand. And I agreed with her. So my job as a chaplain in that moment was to hold her grief and to hold her anger, and to kind of pray with her through that anxiety, through that grief. And for me and my personal reflection, as a chaplain, I take pride in being with patients in their last moments. And so that's been something that has taken a toll on myself, and I know some other colleagues of mine, not being able to provide that end of life care and being physically present in those last moments is a grief for patients, for families, and for chaplains alike. We grieve that no one was there to witness that patient's last breath. So as the summer progressed, we learned more about the illness, and chaplains were able, like myself, to do more in-person visits. In hospice, I provided pastoral care to a family whose loved one just passed away from COVID-19. I was asked to go and offer care in the home, and I had to really gather my anxieties in order to kind of to provide the care that I knew the family would benefit the family at the time. When I walked into the home, I did not know what to expect. There was at least 10 people in the home with the COVID patient, all unmasked. It was a small home. It was hot. I was wearing a apron, a hairnet, N95 mask, a plastic shield, and it was kind of the beginning of a heat wave. And I was kind of tasked with reading scripture and with praying with his family, who was distraught that they just lost their matriarch, while I was concerned, really overwhelmed with concern for my own safety and my own health, and safety primarily because it was so hot and I was getting really overheated wearing all of this protective gear. And so I felt like I had to manage so many different things and balancing safety protocol with compassionate care. And I felt like I had a job to do, but I was also very concerned. And so it was a lot of balancing self-reflection with anxiety management, which I think is particularly thematic throughout the course of this entire pandemic. So as we know, in the midst of COVID-19, we as a nation experienced a slew of racialized and televised violence, and to which I think that the broadcasting and the viral clickbait nature of Black death is one of the most deleterious psychosocial triggers to the Black psyche. So as an African-American chaplain, my concern shifted from wondering how my Black patients, who are already so isolated because of COVID-19, I wondered how they're now coping when even turning on their TV just to receive some company could be extremely triggering for them. And I'll add that I think that the racialized violence in the form of police brutality, and vigilantism was not the only form of Black death that was being broadcasted for us. The CDC, when they decided to include racialized data into their data collection and analysis, they found that African Americans and Latinx were disproportionately dying of COVID-19, and also highlighted the slew of health disparities that were already impacting Black and Brown communities. And so in another sense, in another way, Black death, Black illness, Black sickness was also just televised and broadcasted in a way that I think was harmful in a lot of ways to the Black psyche. And so because of this, as a chaplain, I reached out to, in hospice care, I reached out to my African-American patients and families, in particular, wanting to see how they're coping, wanting to check in, see how they're doing in the midst of all of this. And their responses were honestly heartbreaking. There was an overwhelming sense of anxiety, an overwhelming sense of fear, an overwhelming sense of wanting to stay in the house, fearful for going outside, not just for fear of COVID-19, but for fear police brutality or witnessing something that they did not want to witness in the form of racialized violence. I was asked to do a lot of prayer for grandchildren, for nephews, and that while the patients are asking me for prayer for their nephews because they're afraid of their nephews walking outside and getting murdered while they're in the hospital fighting for their own lives. It was a really interesting time, I think, to be kind of as a minister who is committed to social justice while navigating a healthcare system that we know has had a harmful impact on African American communities in particular. So I will share, I'll end with a fun story of hope that I had experienced in the midst of the pandemic, and then invite us to questions and further reflections. I had a patient, and while I was a hospice chaplain, I had a patient who in her final weeks was passing, not from COVID, but she was homebound, and her final wish was to be married to her fiance. And in their county, because of the pandemic, they were allowed to appear online for their marriage license, and she did not have to leave her home. So I officiated my first wedding, and it was the most beautiful ceremony that I officiated. And this pandemic strangely added for this woman to be realized. So I'd like to end on that high note and now invite everyone to share any reflections or questions that you may have now.
Thank you so much, Reverend Chapman, for that story of hope at the end, and also for just this really poignant and just difficult overview of the work of providing spiritual care in the healthcare system right now. If anyone has reflections or questions, feel free to unmute and jump in. If you prefer to type it in the chat, we can read the question out loud. I'm curious, the family that had you come into their home, that was a health risk for you. What was your decision process like in terms of accepting that request to go there in person rather than suggesting telehealth? What sort of inner dialogue did you have to say, okay, this is the best care that I can provide for this family in this moment?
Yeah, the family had a lot of distress. It was a big family that there was a lot of emotional family dynamics that really necessitated, I think, a presence in the space. And so, so that's kind of how I chose to do that. I had, had someone meet me to bring me extra supplies. So I felt pretty prepared when I walked in, but there was definitely a sense of anxiety as I walked into the space. But knowing I took short intervals, so I was only in the home for about 5 minutes at a time. Then I would leave, and I would come back when they needed something, and then I would leave. So as I mentioned, kind of managing safety protocols along with compassionate care was kind of how I chose to offer care at that time. Thanks for that question.
I have a question about how you get involved with families. Like if you're at the hospital, I assume that you go around and people invite you in, or is it by, because some people are reluctant to have spiritual guidance during their difficult, terminal illnesses particularly. Do you wait for a family to invite you to come, or does someone on the staff recommend that you go in? How is it that you, and how much more complex must that be now that you're not physically at the medical care facility?
Mm-hmm. It's kind of a both and. So oftentimes staff do recommend chaplains to visit with patients or families, whether that's in the facility or over the phone or through telehealth. And oftentimes families do reach out. One of the things that I did notice a trend is that my referrals have decreased. And one of the reasons I think that is because family are not able to visit their patients, their loved ones in the hospitals right now. And family were often the folks who called chaplains to come and visit. And so when the patient either not able to speak for themselves, or when it's family that really needs that support and care at that time, that's kind of that referral system is missing at the moment. So, so my referrals have gone down. A lot of it is nurses, physicians really wanting to provide a little extra layer of support for their patients who are alone in the hospital right now. And so I think that we kind of provide that really helpful little layer, especially right now. Yeah. Thank you.
Two great questions in the chat. I think for a lot of us, all of this is happening in the healthcare system without it being in our public view. So Natalie asks, how can we support people like yourself? Is there a way to help ease your emotional burden? And then kind of a corollary to that, Harry asks, how do you manage your own self-care? So how can other people ease your emotional burden? And then how do you take care of yourself?
Those are fantastic questions. For me, one of the things that I definitely started during the pandemic was a meditation practice. I have meditated almost every day since the beginning of June. And that was a very intentional and conscious effort for me to prepare myself for the day, and recognizing that as a spiritual caregiver in the midst of so much suffering and crisis, I need to be still and centered enough to provide support to not only the patients who are suffering, but to their caregivers who are suffering as well. So replenishing myself spiritually has been I think the number one tool in my belt I've used. Apart from that, I think the way that we can be supportive, especially spiritual care providers, clinical spiritual care providers, is through prayer, through knowing that we have those who understand what we are going through as well. I think in so many ways, we have witnessed the heroism of clinical providers, particularly nurses, particularly emergency room nurses, who have been phenomenal in this frontline work. And I think recognizing some of those other auxiliary staff who have been supporting them is really helpful. It's something that I think would make us feel good, whether that's housekeeping, chaplains, social workers. I think that remembering that it is a huge system, and there are so many of us that are really working to try to keep the system going in the midst of so much chaos, would be it's just very helpful.
Yes, Jacob. Hi, Jessica. I'm so glad to see you again. Here's a question for you. It's in the aftercare, right? We were very, very active in the counseling and care of the families who would come together for receptions, grieving and processing so much grief together. Can you comment on the aftercare of these families who are not properly able to grieve? Properly able to grieve together, I guess. Or do you see that as being really consequential?
You know, so that's reminding me of some of the difficulties I heard families were up against when they were trying to navigate funerals, and how having memorializing their family's death, and it was that added an additional layer of grief to an already grieving family system, not being able to gather together, not knowing when they would be able to gather together to mourn the family's loss. And so as a chaplain in hospice, there was a lot of bereavement follow-up with families, whether or not, you know, the patient passed of COVID or not, because there was just a lack of being able to mourn together, to collectively grieve. And so there was individual counseling. There was a lot of facilitation of like creative ways to gather and to memorialize patients. And I think the creativity is kind of the main word that's coming up for me, is how do we facilitate this communal grief and lament that is so natural for us to want to do in the midst of a time that it's almost impossible to do that. And so finding creative ways to do that. I think a lot of funeral homes also found creative ways to help facilitate that communal mourning. So that was really interesting to see. They, of course, had their own anxieties, with the way that they process things. So that added an additional layer of complexity. Funeral prices almost doubled in some counties. So not only, to be creative and to find these avenues and pathways. Yeah.
Yeah, thank you. As a corollary to that, as you're working with families who are facing these challenges of how to properly care for their loved ones, do you have any advice for the people on this call or who might watch it afterwards, who they have a loved one that they can't visit and they're really struggling with their own emotions of what to do? How would you counsel them on how to best care for their family?
Yeah, that's great. So one of the things that I have seen is a lot of calls that I have been getting are from local church pastors who are reaching out on behalf of the family who, may have experienced red tape or doors in trying to communicate with healthcare staff as they are trying to reach their loved ones that they can't get a hold of, especially their loved ones that are in COVID units. And so they use their local church pastor to reach out to the hospital chaplain that's at the hospital. And I think that's just a phenomenal way of utilizing resources, of finding an advocate that may be able to kind of navigate. And a couple of the times when I had either a priest or a pastor give me a call, they'll say, I did CPE at this place, and I know this is about Chapman. So trying to kind of bridge that connection to really, and I hear them really wanting to advocate for the families in their parishes and congregations, and kind of finding these ins and how to facilitate communication, because it's difficult to communicate a lot, oftentimes with clinical staff, whether that's at a hospital, at a nursing facility, or anything like that. So I think finding an advocate in the clinical system, or who is willing to navigate that clinical system for you, and if you're having difficulty with communication or understanding, what's going on and how to navigate that, I think advocacy is one of the best ways that we can get through.
Shirley asks in the chat, have you had to deal with the anger among family members who have differing views of when it's appropriate to take the risk to gather?
I think generally, we see in the hospital oftentimes families that want to visit patients and not having a full understanding of the precautions of why they can't visit a patient. There's a lot of grief. I see that anger as grief, and not wanting to, grieving the not being able to be with their loved one and feeling as though their loved one is alone in a time when they would definitely benefit from support. So I think for me, that's in the context of clinical chaplaincy, that's kind of the only space that I have experienced any anger. It's in the context of hospice when I'm doing community work, for instance, going into a home, with 10 people in the home. My role is not to ask people to put on masks. My role is to kind of maintain my own professional boundaries and knowing, okay, well, maybe I will make sure I stay 6 feet back, or only stay in the home for 5 minutes. So I haven't really had to too often project my own, my own opinion of when or when not to gather. I think in the context of clinical chaplaincy, those boundaries are kind of set for me already.
Tracy, in your work, do you minister a lot to staff as well as to patients and families?
Absolutely. I think that that is probably in the beginning phases of the pandemic, that was definitely the focus of our care. And because in a lot of ways, the auxiliary staff kind of stopped, just kind of hard stopped going into the clinic, hard stopped seeing patients. And so there was a lot of kind of, what do we do now? And the ways that we kind of filled that was by supporting and caring for the nurses who didn't have the opportunity to not go in and to not visit. So yeah, a lot of staff care. As I mentioned in the beginning, a lot of, for me, providing meditations. We had a 30-minute chaplain call every day at lunchtime for staff to call in, where chaplains would take turns praying during that 30 minutes, or providing meditations, or providing, just different reflections, just offering staff a time to breathe, relax, let go, and find support. I did some one-on-one support with some staff who were kind of at their wits' end with feeling like they were continuously put in harmful situations. And so I think that's something that chaplains have continuously done, but it was elevated definitely in the beginning of the pandemic.
I feel like you would be a really calming presence for staff, to just be the person that when they feel so overwhelmed. Thank you.
Tracy, I'm also thinking of the more mundane. So often in hospital time, visitors not only lift your spirits, but they seem to provide an awful lot of the basic care that you need, because nurses are so busy, and it's not really their job. And so I'm just wondering how patients are feeling, not only in terms of being lonely, but in terms of maybe not feeling like all their regular needs are being met. They're not, and I'm thinking of even, people not necessarily suffering from COVID, who might, just be glad that they're doing well, but those who are going in for other needs.
Mm-hmm. Yeah, absolutely. And that's a part of the advocacy piece that I mentioned. So there are families just calling in, trying to find someone to talk to make sure that, the patient has this medication available, to make sure that, the patient has their diabetic meal plan. There is a definite concern and fear, especially for the patients who can't speak for themselves. And so I think, there's a huge gap in communication in a lot of ways. And so in finding those advocates to be that kind of gap, that bridge, to ensuring that their loved one is cared for in whatever clinical system they're in, is definitely a necessity. That's absolutely an issue that I've seen. Mm-hmm.
Great questions. I'm just going to jump in really quickly. I see Amy just unmuted. It's Jessica Chapman, so I just wanted to make sure people were using the right first name.
Jessica, I'm sure that this morning you've touched all of us, especially with your work and the firsthand stories that you've told, but you've probably only scratched the surface for those of us that are not directly involved. And I just hope you walk away, number one, with our deep appreciation for this work. I can't think of any more important work during this time. And then also, if you can share with every frontline person that you know that how deeply appreciative everyone is for what they're doing and how much we hold them in our daily prayers.
Mm-hmm. Thanks, Amy.
Any other questions or reflections for Reverend Chapman this morning? right. Well, thank you, Reverend Chapman, for being with us today. I think it was really important for us to get this glimpse into all this amazing work. As you said at the beginning of your time, that we are celebrating the heroes of the healthcare system. And you mentioned the nurses and doctors and housekeeping and respiratory therapists, but we also include you and all of the chaplains and spiritual care providers that have been working so hard in such a difficult time. And so I know that that weighs heavy on all of our hearts, just to make sure that people are cared for during this time. So thank you for being with us and sharing with us.
Thank you.
And you just unmuted. Did you have something you wanted to say?
Yeah, I just wanted to thank Jessica, and I wanted to say that I know for a lot of people, the work of chaplains and even the presence of chaplains is not even known until you or a loved one is in the hospital. And that's the first time you become aware of that service that is available. And so I just want to, I hope that everyone who was here this morning, if you didn't know about chaplains, can talk about this with family and friends to spread the word that service is available. I think it's so important when people are feeling so vulnerable in the hospital, and also that it gives people a sense of comfort knowing that that your loved one is taking care of people like Jessica Chapman, who are there when we can't be on the other side of the hospital walls. And I also wanted to say congratulations, because I know that you recently got married, and so I love that you were able to find some joy in the midst of all the chaos. So congratulations.
Thank you. Yes, it was a very light spot in all of this chaos. Appreciate that. Thank you for the invitation to share with you guys today.